So when the pandemic first started, there was a lot of confusion. People were unsure about how healthcare was going to be delivered and what the needs were going to be.
I find so many people, they just feel alone and not sure of what they can do.
I was now a patient and I had to drive into the city on my own and go to the cancer clinic, get screened and have my treatment and drive home alone.
Between the intense anxiety and fear and just the shortage of time to go through so much information in a small hospital where you don't have an infectious disease department, you have an infection control nurse in charge of that, and you have the clinical leads of each department. But I can speak for myself and everyone I worked with. We were all, I think, at some level wondering how we would ever get through so much information changing so rapidly.
To help the province and the healthcare system as a whole, this is what our part was, to take IFT transfers, to make sure patients have the proper care in the proper hospitals.
I think our lives are going to be permanently time-stamped. What our life was pre-COVID and what our life is going to be post-COVID and has been post-COVID. It has just altered every aspect of our lives, of our economy, like our family settings, our values. It's just altered absolutely everything, this one tiny little virus. It's mind-boggling.
Given that we have this mix of rural, remote, urban, and certainly underserviced communities, it was going to be a real challenge as to how we could make sure that everybody across the county was going to have access to a COVID assessment centre.
I truly believe if emotional support wasn't provided to residents, it just brings on a whole other stronger form of depression than anyone could ever imagine.
Up at entrance C, what we do is we allow one family member per patient to have visits 3 times a week for half an hour. So when they come in, then I get to do the screening with them and either take them to the patient's room, or we have it in the entrance. It also depends on whether or not families are allowed to come in, which makes it difficult. So just kind of being that face to let everybody know that your loved one is okay. We'll get through this together.
You do what you want to do, not because you have to do it. When the call came out, did you want to help out at the vaccine clinics? Everybody was very anxious. And I think it's because we've been so trapped, so restricted by COVID with, we can all wear masks, we can wash our hands, we can cough into our elbows, we can keep our distance, but we can't do anything. That virus kept infecting. So to have one small chance to fight back and help out, it was just my very first day working at the clinic. I came home exhausted but exhilarated because take that COVID, we just did 600 shots.
We knew very early on was that having one site somewhere in Renfrew County was simply not going to serve the whole county. And we also knew that we didn't have the resources to have 6, 7, 8 sites dotted across the county. We just didn't have the funds or the staff or the overall resources to do that. We wanted to protect our emergency departments and our 911 paramedics to deal with genuine emergencies. But at the same time, we wanted to make sure that nobody was left at home to suffer in silence without any access to healthcare and certainly to COVID care.
The pandemic has affected my personal life on different levels, with being diagnosed with breast cancer in late 2019 to then follow with surgery in January 2020, and then treatments to follow. And and then homeschooling. I have a daughter. And so the first lockdown was basically my first radiation treatment. That was scary, and it felt like isolation because I had to do that all alone. Seeing the residents, when I returned to work after being off, they gave me hope that we were in a safe place and we were like a family. It feels like a good community that we have. We're strong, and I feel like we look after one another.
I believe that the pandemic has had a huge impact on everyone, of course, but especially from my line of work, the families and the clients. I think it's just a bit isolating because some of these clients also live on their own and they're not going out into the community like they used to. They're not having as many visitors. Of course, depressing is a big word that is out there because you live a life full of social aspects and just all of a sudden that being taken away.
I'm the treasurer for the little gift shop in the hospital. So it's like a tiny little room in the hospital and we sell gift shop items. So for example, 2019, we had $20,000 in sales. For 2020, we had 4,000. So and I know everybody's hurting that way, but for the auxiliary members, their chance to give back to the community, it's so rewarding. Volunteer work is just so rewarding, and it's gone now. And our in-hospital people that do palliative care and portering, they can't go in. It's been a severance from us being able to help. And so when you want to help and you can't help, it's heartbreaking.
ER preparedness was an evolving process. At the beginning, we were scrambling like everyone else to come to terms with what we were dealing with. Patients coming in were scared. Anyone who walked through the department as part of their role in the hospital, from house staff to diagnostic imaging, everyone was scared of being there, I think. That was reflected in the early weeks by a dramatic drop in ER numbers, as unfortunately people were scared to present, I think, to any healthcare facility in person for fear of catching this new disease that was out there.
When COVID-19 affected the world, especially as a healthcare worker at the Grove Nursing Home, to be honest, all staff were living in fear. It was the unknown of what is this virus, how is it going to impact us? Initially, it brought on a lot of loneliness and depression for the residents at the Grove, not being able to see their families, their friends, or any of their loved ones. We were all facing the same struggles every day.
COVID has changed everything for everybody. The not being able to socialize, not being able to hug is very hard. I'm a hugger. I'm one that wants to check in on everybody. So having to stay back and show distance has been difficult. I've had a loved one that's passed throughout all of this. My dad died about 2 months ago. Not of COVID. But not being able to have a normal perception of life was really difficult. I find so many people, they just feel alone and not sure of what they can do. The only amazing thing is that we have all the technology that we can celebrate, and it's not the same, but it'll do for now. I've made so many new friends just with the families coming in because their loved ones are here for so long, and getting to know them and being there to support them when stuff goes wrong, or rejoice with them when their loved one gets released. I truly take that as a passion of mine, is connecting with people and being able to help them through good and bad times.
We spent a lot of one-to-one time with the residents to answer any of their questions or listen to their concerns that they had, and just be there and support them as much as we could when their loved ones couldn't be there for them. We were so used to having, volunteers and entertainers coming in, and then that all just stopped. We started doing Skype visits and FaceTime visits, and eventually we were able to do outdoor visits to keep them connected as much as we could at the start.
What makes us stand out is that across the county, there are no walk-in centres, there are no urgent care clinics. So for our 25% plus of the population that don't have a regular family physician or primary care provider, the only other option was to go to the emergency department if they had a healthcare problem. Since March 2020, we've done over 50,000 COVID tests. We've had almost 25,000 virtual assessments with a family physician. And we've had almost 5,000 home visits from a community paramedic. Those numbers really are extraordinary.
Yeah, so those were difficult challenges because it was scary. It was scary for, everybody here at the hospital, the community. It was new. There was so much unknown, and still there's, some unknown to a certain extent. Trying to learn IPAC or infection control on a normal day without the pandemic being here. And then the pandemic and the changes and the constant new directives or from Ministry of Health, and educating my staff here and, keeping them less hesitant towards change.
Work in a hospital is always stressful. COVID just brings on a little layer of stress that's a little more stressful. My life has been good though. I can't complain. I can't travel obviously like no one else, but there's lots of work. You feel needed. We've been lucky where we haven't been inundated with COVID patients or burnout, but you do feel the extra stress in the air. As a team, I think we're doing well at keeping everyone positive, and we just keep things moving. It's about being safe and smart with decisions and making sure you have the proper PPE all the time. But I think our team really made a big difference, helping with the inter-facility transfers and keeping positive and keeping people moving. I think we're doing well. So I just want to thank our team coming together, and in our group huddles and meetings, I just really wanted to know that this is our part in COVID. Luckily, we've been spared as having very few COVID patients in our hospital, and I can't thank them enough.
Working at the Grove, I had a focus. I knew that the residents needed me. My biggest win would be spending the one-to-one time with the residents and knowing that I was able to support them.
The main bonuses that came out of being involved in this was seeing the synergy that comes from primary care, paramedics, hospitals, public health, and all the other community providers working together. There is just no doubt that we are more than our component parts when we work together. And I really hope that moving forward in the years to come, we're able to build on that and really learn from our achievements with VTAC. And like I said earlier, make that benefit the post-pandemic healthcare service as well.
I think a positive is I've truly learned who means the most to me, who will reach out, who will check in. Myself personally, I try to do two friend or family check-ins a day just to make sure everybody's doing okay.
I just think that all of the staff at the Grove Nursing Home should be really, really proud that we have come through this pandemic thus far without having an outbreak. And we've been so fortunate, and a big kudos to all of my coworkers.
My heart was still set on helping families, that still have to go to work and, burnout and all that. We started the in-home one-to-one visit program for those who were interested of being comfortable for me coming into the home. So it is just so special for them, and they are so grateful that I am able to come in and just have that social aspect.
The thought of having the vaccine enrolled throughout the nursing home has really brought a lot of hope to everyone. It's hope that maybe someday soon our lives might return back to normal. We might soon be able to have more visitors in the home. We might be able to see those family members we haven't seen in so long, for the residents and for us staff personally as well. So I truly think that the vaccine is what's giving everybody hope in moving forward and knowing that there is light at the end of the tunnel and we will all get through this together.
Using all the resources you have is very, very important, that we all work together to, come up with the best solution to everything. So I really enjoy working at Arnprior Hospital, and I think we have an amazing team here. It's an amazing, amazing experience to watch. Number one, the volunteers come together and help out, stand out in the cold, in the rain, in the snow, in the wind. And then last week it was in the blistering heat, greeting people, talking to people, helping people, guiding people. It's mind-boggling. I know we've all said it before, but take that COVID. The vaccines are going in arms, and we're getting more volunteers coming out every week. Just take that. You're not going to keep us down. We're coming back.